This is DLFM Online Radio Station Chicago. Dimensión Latina FM Radio TV. Baja nuestra aplicación a través de tu iPhone o Android. Búscanos como Dimela FM. Búscanos en TuneIn Radio como Dimensión Latina FM y visita nuestra página web dimelafm.com.
Hello, everyone. This is ELSA PRADO, host of Wings of Love. We are broadcasting live through Dimensíón Latina FM in Chicago. Today we have a program with Ricardo Jimenez, Director of Public Health Initiatives. Welcome to the program, Ricardo.
Good evening. How you doing, everybody?
And we are here because we're going to be talking about a program that's taking place in the city of Chicago. They just initiated the 31st Fiesta Boricua. It's a street festival in Chicago, and it took place on the 31st of August and September 1st. But as a result of this, we also want to let the community know and inform the community about the health initiatives that are taking place in the community. So we have Ricardo here to talk to us about it. And go ahead, Ricardo. Welcome to Wings of Love. Tell us more about your work and this purpose behind the street festival and everything that you're working on currently in trying to bring about everything that you're working on. Not only are you an organizer, but just to give our community a little bit more of your background, you know, you were at Loyola, and you were the person organizing, correct?
Yes.
You are also returning basically to your roots through the Puerto Rican Cultural Center, specializing in HIV prevention, education, the transmission and linkage to medical care and treatment. I know that you were also talking about some vaccinations for monkeypox and all these other things. Let's talk about this. What is behind all of these health initiatives and the work that you're doing for the community? Many times people do not know about these programs, so it is important we get the information out.
Okay, thank you very much for the opportunity. Yes, I do work for the Puerto Rican Culture Center in the public health section, and that program started in 1988 during the AIDS crisis. The difference was that when we looked at the Latinos and a lot of the Blacks, the gay plague was not being noticed in our communities. We were seeing other people dying, especially intravenous drug users, people who are sex workers, and therefore we don't know one of the modes of transmission was intravenous drug use. Exactly. Therefore, Outcast and we decided to intervene and created a Vida Sida, and Vida Sida, of course, is Vida, and Sida is AIDS. And that's where we started our initiative. People said they would not last because we used that name. But unfortunately, 35 years later, we still exist. And we've been now working with HIV since that time. I think we have to have faith because of the whole thing of machismo and sex that's been gay, especially gay and LGBT, has been very condemned in Latinos. And so therefore, one of the roles that we do is to make sure that we integrate and normalize. These are human beings also like anybody else. And we started working in HIV, getting tested and everything because we were the highest numbers. So during that time, they have always been adhered to making sure community is healthy. If we had some kind of vaccine or anything, or something that has to be associated and be informed, we always took the lead. Of course, we've done that with HIV, we've done that with treatment, we've done that with our name only, just to make sure that we normalize things. Recently, what we had said was in 1922, there was an outbreak of what's called smallpox. Okay.
Yes.
and looked at that smallpox and who were the ones that were being infected at that time, and it was a certain population that was happening to. So it was called Clade 2. It is a type that was caused a global outbreak in 1922, and it comes from the smallpox. Okay, but during that time, Clade 2, 99% of the people survived. Recently in Africa, there was Central Africa and West Africa, another clade was identified. It's been a while, but it had not moved. That was Clade 1. And Clade 1 here now is responsible for the current rise of cases in Central and Eastern Africa. And what happens is that in the Republic of Congo, it is attributed to the Clade 1 monkeypox virus, distinct from the Clade 2 monkeypox virus. Is responsible for the ongoing outbreak that was connected in 22. The Clade 1 has been associated with a higher incidence of severe illness and mortality, as well as higher transferability in comparison to Clade 2, particularly in the African region. Now I want to tell everybody that despite comprehensive wastewater monitoring for community detection and vigorous testing of significant portions of presumed Mpox specimens utilizing Clade-specific diagnostic techniques, no cases of Clade 1 has been detected in the United States yet. Okay, but we know that last year the COVID-19 strain came to the United States. We know that HIV came out of Africa, and we know that eventually these viruses do travel. And this is one of the biggest things that we're doing now, is that unfortunately, Clade 2 is a type that the Clade 1 causes more severe illness and death. And the outbreaks have killed up to 10% of the people who get sick. But in particular, children have been the most affected in Clade 1. And it's, more than 70% of the people that have been identified with Clade 1 Mpox are 15 years and old and less. Now, I know that Africa, there's different conditions that we have there, but unfortunately, we know that it might come. So what Chicago Department of Public Health and others have started organizing is to get a sense of awareness that this is going on. And when we have this kind of virus like we did before, what can we do? There are preventative measures that we can do, because we can take this Mpox vaccine that will minimize your outbreak, your symptoms, and be less infectious. Remember that the smallpox vaccine, when it's given to a child, is usually about maybe 6-7 years old. So if you have Mpox over there, they have Mpox in it. Then this is what's causing all these little kids to have Mpox and, maybe die, a possibility. I know I'm not going to say this is going to be repeated here, but for preventive measures, what's being asked, that we're going to be being available, the 3 vaccines that are most in need now for the winter. And that would be the first one, a regular flu vaccine that we get about one every year. Now we also know that we had COVID-19, K2 here, and K3 now is here already. This new vaccine that's going to be available and approved now by the CDC will be available, and we'll have that vaccine. And the last one that we want to make it a routine vaccine will be the Mpox, in order to avoid an outbreak like what's happening in Africa.
And a lot of people are like, wait a minute, Africa's really far away, but we always have to consider everything reaches the United States really quickly. And once it spreads and once it's here, it's like the COVID. People thought, oh, COVID can't reach the United States, but it did. And we were burying people left and right. And it took, a lot of heartache and a lot of cases of deaths for this to be understood. So I understand, and I'm hearing it loud and clear, prevention. Prevention is the key. And through this, people will be able to minimize, hopefully, any outbreak that might come to the United States, and minimize all the heartache and the pain and the hardships that it causes.
Exactly. Especially if we start now. I think we also had doubts about COVID-19 and how did they come up with it. And then later on, they know that they used all the signs from HIV as far as
Hmm.
antigens and how to get an antigen test for a virus that was developed through HIV, and then conformatories and everything. So all that science was there. And now we do have the science available that this is, it's been around for a long time, Claude 1, but it has not reached. Now there is a momentum where parts of South Africa, it's spreading in West Africa. So then if that's the case, we should take measures to make sure that we protect us also, but moreover, our children, that is.
Absolutely. Yeah, and it's always the young, the children that end up passing away from a lot of these illnesses and get taken quickly. Sometimes they think that children are very strong, but yet many children die of all of these illnesses.
Yeah, so the Chicago Department of Public Health, CDPH, will now start firing a campaign. And also there's going to be vaccine clinics throughout the city in order to be able to provide the Mpox vaccine. The Puerto Rican culture has made various times vaccine clinics, and we will probably be in collaboration with other agencies, maybe Howard Brown, ASIS, or in the CDPH in order to make a vaccine available. We're going to be in Humboldt Park and also in Belmont Cragen. We have another area. So the Puerto Rican Culture Center is going to start its initiative to see if we do a set of education and also provide the vaccines that are very much needed in our community that's always neglected.
Absolutely. And a lot of times, they don't look at the people that are in a lesser place where they don't have a lot of times medical insurance.
Exactly.
They don't have the coverages, the benefits that other people enjoy. And that's one of the reasons it's so important that we get this information out to the community. Give us some dates, like when approximately will you be having this available for the community, more or less, if you can give us like the time frame that we're looking at.
We're hoping and we're looking into the fact that one of the big events that we have is what's called Haunted Paseo.
Haunted Paseo.
A lot of people come, a lot of kids come, family comes. And we thought that would be a great opportunity to unite those two, have a vaccine clinic available, and all these kids that are around and everything have that vaccine available for them. So we're looking at maybe at that date in the end of October, or if we we'll do one, in the second and a half, mid-October, last of October, and hopefully we can do one right at the beginning of November. And then everybody should be vaccinated by that time because they expect a good flu virus to come around also. And of course, now the whole COVID is also a variant also because sometimes we wind up with one in the last of the part. But if you do have the vaccine, you are protected. One thing I want to say is that a lot of people have had COVID. If you have had COVID, do not take the vaccine right away. Please wait about 30 to 40 days, okay? Because your body already has an immune system and it makes antibodies. So it's already fighting your COVID already. And whatever strain you have, you're in good health. Unfortunately, after you have a virus, you're really in good health because you have all the antibodies and they're fighting it away. So if you have had COVID during this time, and if you had the K2, that means you already have antibodies for it. So your body is pretty good in shape, so you can postpone that vaccine till about maybe 30, 40 days later, probably or something, it would be good. But the flu stays the same and the Mpox is one, but then you have to take a follow-up.
How many are for Mpox is how many in a series?
Two. It's two.
And it's a two series.
And they'll give you another appointment for the other one. Okay, because because it is a very strong situation. They have a follow-up, and it's a very new. The vaccine has been updated, and so it's been very effective throughout. So, and I also have seen people who had the vaccines and was exposed to Mpox, and their symptoms and is minimal, and their recovery is much more rapid. So therefore, it is a very good choice and wise to make sure that you do get vaccinated during this time that they expect a whole upheaval of different viruses going on at the same time.
I need to ask, do they have the HIV vaccine yet, or any kind of like a shot of some kind to help people with this?
I think today most Latinos do not know that any person who's living with HIV takes medication, the new medication that's been out for years now. In 3 to 6 months, they become undetectable, which means they cannot transmit the virus.
And that's huge.
Unprotected sex.
Right, that's huge, because a lot of you know what I mean. It wasn't like that in the past. But
it was a death. And to be able to live with HIV, meaning that you limit yourself to who you are sexually and everything else, because you don't want to give it to somebody else. But now we do have a light in that dark tunnel. We also have a tablet that if you take that tablet once a day, it keeps HIV away is what I called it. And so those are the strategies to end HIV. Now, do we know, is it working? Yes, it is. You know why? White folks have lowered their infections by a rate up to, in some places, 50%. The problem with us is that we don't have accessibility. It costs money to get this medication, and you're talking about maybe $15,000 to $20,000. So therefore, in the state of Illinois and in the city, PrEP is called PrEP. PrEP is available for people who need it, who might be at high risk for HIV. And so the city and the governor here has been very, very good in supporting that. And as far as our medication now, we're now mayor inherited. And so it's more available. So I think the Latino population is eventually going to benefit. But we have to work in ourselves to stop the stigma of HIV in our community.
That's why we got to do these programs, because people need to be a little, stretch the mind a bit, be more open-minded about the possibilities of bettering the situation.
Yeah, because we have to live it the old ways that we're in the machismo and thinking that if a man is gay, he's no longer a man. That kind of stigmatization, we must stop. Especially when we have our kids raised here from our country, out of our countries, they're going to be exposed to all this. And therefore, we definitely have to make sure that our kids are happy, they are well informed. And especially when they're having sex at an early age now, our job is to make sure they're protected and taken care of. So I think today with HIV, it's definitely a big sign to the Latino population to able to accept people who are living with HIV. They're normal. They're not gonna get the disease. And now we see that it could be also prevented. And eventually, we're going to see this virus, which is now very, very manageable, be something.
Yeah, it's not a death sentence anymore the way it used to be back in the day. Back in the 80s, it was a death sentence. It is no longer a death sentence for most people, and most people can have very normal lives and very active lives and go on with life.
Even have children and everything. People who have living HIV and are detectable, they have had children, normal children like anybody else, and not living with HIV, the children neither. So I think that puts a whole human aspect to this situation that now hopefully our Latino community can start dealing with that stigma and not put somebody in such an ugly position because they are living with HIV.
Yeah, and it also comes to that, just having a respect for one another, respect people's, whatever people choose to do, that's their own prerogative, and, respecting them and not judging. Judgment is probably the worst thing, that affects our community the most. I mean, the judgment and the prejudices that exist in the community are probably the hardest to
a human perspective. I admire, I know that a lot of religion is very anti-gay, but I gotta admire the Pope and what he said recently about the gay population, the LGBT population.
Go ahead. What did he say? Go ahead.
He said, these are human beings, regardless of the fact, that they are, they say committing sin or whatever. These are human beings, and this is what's first. and most important, to treat them humanely because they are human beings. And that was one of the biggest support to the LGBT community, because definitely it has normalized and say, quit condemning them. Don't stereotype them, don't stigmatize them, but love them, cherish them, and let them be part of the community that they belong to.
Right. And one of those things is just being mindful. I mean, I don't know if people think about that, just being mindful of others.
Yes.
It's really important. When we become a mindful population, we will change the way we live. Truly.
Let humanity drive the nation.
Exactly. Yes. The humanity, yes.
Because that will definitely overpower anything else, especially during this time where we see so much hate, divisionism, and really, outright racism for us, for people of color, what they're going through now in this time. It's something very, very important for us to understand that sometimes we get rights, but then they can also be taken away from us immediately. And we must cherish those rights, take care of them, and also defend them.
Right. What would you say to the parents that may be listening, the parents that are raising teenagers per se right now? Because there's a lot of times that, I don't think most parents sit down and want to talk about the HIV. They don't want to talk about the monkeypox. They don't want to talk about these illnesses. It's like, why are we going to talk illness? Why?
Yeah.
What can you say in your experience as a person that's been organizing for such a long time? You can bring something to the table for parents. What would you say?
I think the first and foremost, we have to understand that regardless of the fact that kids, and I know parents want to have a relationship with kids on a very close level, for Latino, it's very hard for us to talk to our parents about sex. Yes, it's easy. Our tradition makes it very, very hard to do. So might not happen, but then on the other hand, there's places where they can get that education. And also, if you have, a lot of parents have feelings with their kids, and they, I think something's wrong, but it's not something wrong. It's that you're gonna have to open that heart. You're gonna open that mind. And even though you might not like, because traditionally we're not raised like that, you must do it. A human. This is the child that you brought to this world. This is the child you raised. This is the child you loved. This is the child that you want everything good to happen. And now you want to let it go because that person now loves the same sex. Okay? We can't. Just that's something that we have to work on, And if I know our religious faiths, with the love of humanity, you can do it. I tell you that I have one thing about Latinos is that when they have relationships and stuff, man, they go home and they have relationships and they have their apartment, they break up with their partner. Where do they go? Back home. Get in that room and leave me alone until you get over this, whatever. That has not been the case for LGBT. For the first time, I see Latinos throwing their children out. That's incredible. We've never had that kind of attitude or have that kind of way to deal with our children. You always welcome them back. And so now we see this. So we see them homeless. We see them in the street. We see them doing drugs. We see them selling themselves because they have nothing else to do.
And they have nowhere to go.
That's why we
need to talk about that. You can't, you can't throw your teenager out of the house and cast them to the streets, because some of these kids, I hate to say it, they're cast to the streets. Yes. They're thrown out like the garbage.
Yes.
And we have to be open about it. We don't throw our kids out to be garbage.
That's why we develop traditional living quarters. We have the PRCC has a traditional living quarters for LGBT 18 to 24 or living with HIV. Because of that, it was so incredible when we did an investigation. 40% of the people who were homeless were kids, and out of those, 40 were gays.
Right.
Also, I'm not just Latino. A lot of Latinos and Black, but there's also white kids and everything else there also. But that community has been, stigmatized, especially since the 1980s, and we're opening the world, and it just continues. Same thing with the trans population. We have to understand that all the other ones are sexual, but the trans population, that's gender oriented. That's a whole different dynamic that
Exactly.
we have never understood until now. We're getting
Right.
to understand it. And so
Yeah.
therefore, and I feel, because I see all these kids and all the stuff they're going through, good people, good with a lot of love and everything, and completely shattered because their parents has rejected them, their family has rejected them, or they
Right.
can never be who they want to be, and be
Right.
all the time. I think the parents have to really look in deep in your heart that this is your child. This is the love that you brought to this country, to this world. And I think you have to look at it really, really in a different perspective, that you would not want that child for something to happen and you find out that they were killed or murdered or had overdose.
Or they're being trafficked.
Exactly.
How many are being trafficked? And we have to say the words. Yes, it's uncomfortable. It's really uncomfortable. But you don't know. So many parents in our community don't know.
That's right.
This is your child.
Yes.
And this, whatever drove or made that person feel the way they feel for the same sex is there, for them to live with. But to condemn them, to ostracize them, to belittle them, to punish them, to throw them in the street and put them in a position where they're going to end up lost in alcohol and drugs and prostitution and trafficking and all these horrendous things that happen to them because they can't be loved.
That's right.
Then what is love?
Yes.
What is love?
Yes, that's sad, sad, sad. And I hope that we don't continue to have this kind of attitude and behavior, towards the future of our kids. And that's not going to change. I hate to tell people who they know.
That's what I say. You can hold on to your beliefs and you can say what you want to say and just be judgmental. But what will the judgment get anybody? What will all this judgment, you're throwing stones at a person that is a human being.
And rejecting that life and that person, to
Mm-hmm.
they have a lot of potential. And so I think that's where I would tell them. I think they have to start looking and remember, we come to a different country, and even our countries, the movement for the freedom and rights of the LGBT is very, very strong. And you also have forces working against it. In Puerto Rico, you have a project that's totally organized against the LGBT and electoral, and it's all supported by the right wing here, and I think Latinos also have to understand that when these people take a position that you might support, they're not supporting you, they're supporting their future, and then telling you to condemn your children, and give support against. You cannot be a one issue person, especially for Latinos and Blacks. We cannot continue to do that. The issue is a human rights issue, and it's the one issue that we must support, one issue that we must be aware of, and then we have to condemn, the whole prosecution of the LGBTQ because they're going to exist. It's not going to change. I don't care what religion, what position, whatever you want.
It's not going away.
Not going to go anywhere.
It's not going away anytime soon. For as long as the world has existed, for as long as the beginning of time, this has been just an ongoing problem that can't seem to be coped with because people can't wrap it around their heads that this exists.
That's right. So I hope that in the very near future, we do have a movement, and I mean, for the Puerto Rican Culture Center, I got to give them a big credit because we are the only ethnic parade in the whole United States that our cacique, our king and queens are from the LGBTQ community. Our queen is a transgender. Our king is a gay man. This is integrating into our community and to all the Latinos to show them an example. These are human beings that should be respected and acknowledged because they also are very important to the community and they do excellent work. So I think this is very important. That has been set a very, very good example, and I think that has to continue. And the biggest population here is Mexico, 1.3, 1.4 million, and I think definitely, the community is filled with a lot of them, and so I
The
think
community's filled with a lot of, and it's so sad to see parents tear their own children apart.
yes,
How is it that we bring parents to just understand this is your child? You brought them into the world just the way they, this is who they are, and this is part of you.
yeah,
Whether you're a mother, you're a father, this is part of you that
And-
you brought to the world.
in the end, they will regret, because that's their child, and if something happens, you become alone. When you really have to be in a very different frame of mind to reject your child completely throughout the rest of your life because of some issue of this. It's not. I can't even just even think how a person would actually do that. But unfortunately, I've seen it many, many times here. In Rescate, where we have the traditional, many kids have come, broken down completely. That takes years and years through counseling and everything for them to return back and normalize and accept themselves, be happy, and proceed with their life.
And just to be able to live.
Yes, definitely.
And I think it goes in line with just allowing humans to be human.
Yes.
Why are we dehumanizing? If anything, I would love our public to just ask themselves that question. Why are we dehumanizing others? Why are we doing that? Why?
Yep. Love has no color, no fate,
No.
no direction. It's love, and when it's love and respect and keep the human perspective, I think society will go a very, very long way.
Right? And it will change the way life is lived.
Yes,
It will change the way people live their lives.
exactly.
Because we got to pull out anything that has to do with politics. The government has nothing to do with people's bodies. That's separate.
Yeah, that's
We
another.
cannot, you
Yes.
know what I'm saying?
Yes,
That's totally
I don't even
separate.
understand when sometimes women themselves I don't accept that. I just don't. But that that's an incredible. I mean, these last year was if there has not been a sense of awareness, especially for women, because they hold big power here still. That they can actually change the direction of this country. But then to have those conservative views be accepted by others, regardless of the fact of who they are, and their intelligence and their know-abouts and their and understanding their reality, and still oppose the right of a woman to make her own decision, is beyond me to understand.
Well, like I said, I right now have this huge issue with that whole Project 2025, because what is that Project 2025 going to do to our community?
Yes.
And I, as a woman, stand before everyone saying, why would the government have anything to do with my body?
That's right.
Why? It's a complete moral issue. Has nothing to do with government, has nothing to do with state, has not. So all of these people that are in this situation, and they're called minorities, or they want to be we have all these labels for everything. And then at the end of the day, we're all human.
Yep. My question is to them who are legislating women. How many laws are there against legislation against men?
Mm-hmm.
There's nothing at all. Why you have one against women?
Exactly.
So that that contradictory is so huge, and that's a goal based on paternalism, male dominance, and that they could then subject to the conditions of whatever they make, and they make decisions. They don't even know anything about the human body, the women body, and what they go through, and make these decisions. And I don't know how women can even accept that. Because
it's beyond me.
Yeah.
That's beyond me. Anybody that's on the side of that party to do such an evil act towards our own kind is beyond me.
Yeah. Yeah, so that's either got
Right?
brainwashed or whatever. I don't. Somebody must
But
be thinking.
it's very messed up, isn't it?
Yes.
Very messed up. But anyway, if anybody is interested, which we know there are people that are interested, and I'm sure that people's privacy is protected, confidentiality is kept and stuff like that. And during this process, what is a reach number or a contact email? How can people reach the organization if they're looking for any kind of resources in the community?
You can go to if you want to get a hold of me, it will be Ricardo Jimenez. If you want to email me, it will be ricardoj@prcc-chgo.org. You can also look at our webpage for the Puerto Rican Culture Center, and it will be prcc- the one in the middle, chgo.org. Okay? And Facebook, we have Vida Sida, which is the name of the organization in 1988. And of course, we now have expanded that. And then we have public health initiatives. And then we have different programs for the community. We have Community Resource Response Corps and community health workers, and that's led by Jessica Sierra. So we also have high impact program at Vida Sida. If you look up Vida Sida, it'll give you the name, and then that's Goto. He will do it. And here in the Trans Empowerment Center, we have testing. In all of them, we have testing for HIV, STIs, chlamydia, gonorrhea, linkage to care. In any of our facilities, we take care of that, and we also do outreach. If anybody wants us to do a program and do testing, we can also accommodate any of it. Okay, so you can get a hold of me, and we can do a collaboration. Hopefully, when we have the clinic, I'm going to tell ELSA about the clinic, and she will announce it. And it's going to be right in Humboldt Park between the flags. Very easy to
get to. Yeah.
Get. Mm-hmm. You can, the phone here, I keep forgetting because I just got this also, 773-698-7473.
Thank you, Ricardo. Thank you very much. Muchas gracias.
Thank you.
I know that there's a huge need in the community and everybody needs support. These are tough times and everybody's looking for different resources. And thank you for sharing these resources with us in the community. And it is something that
for a CEDAR program for people who need assistance in electricity and light. We do. We have a daycare center also. And we also have the oldest alternative school in the city of Chicago, a high school, Pedro Luis Ocampo High School. So we have probably as much as we can to provide as many resources as possible. So we do work with the community. We've been there for 50 years generally and help initiatives for the last 37 years. Excellent.
So people, hope that you are taking all this information down. Please share the information with other people. The video will be out, so please share the resources, share everything with, people that you may know that may need it, because that's always really important, that we communicate this information to other people that are in need. A lot of times people are just ashamed. They feel embarrassed about asking for resources. They feel embarrassed about talking about these issues, but we have to stop the embarrassment. We have to stop about we have to just put all of that stuff, the shame and everything on hold, because it's more important to have your life and to have your sanity than to be worried about who's judging you. Yeah. It's just much, much more important.
Let me give the phone call. I don't know if I did it.
Go ahead.
773-698-7473. Okay. And my office is in that building.
Excellent. Gracias, Ricardo. Thank you
you
very much.
for the invitation. I hope we stay in contact, and hopefully we'll be collaborating a lot more.
Yeah, definitely. And that we could get the information out of the flyers that will be coming out for the programming in October.
Okay.
So stay tuned, people. Stay tuned. And, keep your eyes out for more information and everything that's going to be available soon. But at least you have a heads up. You know what's coming. You know who to, direct this information to. And at least you're helping other people. Let's all help one another. And we can help each other by sharing the information and being proactive with people that might be in need but don't want to talk about it. You can address it with somebody in private and you could bring it to their attention. Well, thank you so very much. We're running out of time, but I am very grateful for your collaboration, 2 Weeks of Love, and everything that you're doing in the community. Just keep on paying it forward. Right?
Have a beautiful evening, and thank you for the invitation. I'm most honored to have been here.
You're welcome. Thank you so much for having shared everything with us. And once again, many blessings to everybody and greetings to everybody on behalf of Dimensión Latina and our producer, Freddy Espinosa, Dimensión Latina FM, broadcasting live from Chicago. Gracias. We'll see you soon. Bye-bye.
Aquí llegamos con nuestra programación en vivo. Gracias por tu sintonía. Dimensión Latina FM, tu